Baltimore General, an episodic medical drama. Written by Blue Bolton. Episode 1, Transfer of Care, Chapter 12. Emilia pushed through the door to Jordan's room, where machines shrieked their urgent warnings. The teenager's vitals flickered across multiple screens, blood pressure diving, heart rate jumping erratically. 4 nurses swarmed around him, their hands moving in synchrony as they adjusted lines and called out readings. "He's hypotensive, 90 over 40 and dropping," one called out, voice tight. Shaw stood at the foot of the bed, her eyes tracking every number on the monitors with predatory focus. "Push another bolus of albumin and get 2 units of platelets hanging. Where's that ultrasound?" Emilia moved to Jordan's side. Her fingers found his wrist too cool, too clammy. The sclera of his eyes had yellowed since her last check, his skin now carrying the same jaundiced tint. When she pressed against his abdomen, the flesh resisted, harder than it should be. "His liver's failing," Emilia said, keeping her voice steady. "Look at the jaundice. It's progressing rapidly." Shaw's gaze flicked up, her expression tightening as she registered the yellow stain spreading across Jordan's skin. "Damn it, check his bilirubin and get a full liver panel." His ammonia was already climbing. Against the wall stood Marla Hall, her knuckles white where she gripped her own arms, eyes wide and unblinking as she watched the team work on her son. Emilia caught her eye and gave a small nod. She offered no smile. False hope was crueler than none. "What's happening to him?" Marla's voice barely reached them. Before Emilia could answer, Jordan's body went rigid, his spine arching off the mattress as if pulled by invisible strings. "He's seizing again," Shaw barked. 2 milligrams of Ativan now." A nurse pushed the medication while Emilia turned Jordan onto his side, her hands cradling his head. His muscles spasmed beneath her fingers, his body convulsing in ways she couldn't control. "This isn't just the OTC deficiency," Emilia said, meeting Shaw's eyes across the bed. "The progression is too rapid." The seizure subsided, leaving Jordan limp as a doll. Patches of purplish discoloration bloomed across his arms and torso, spreading like ink in water. "Livedo reticularis," Shaw pointed to the modeling, classic sign of microvascular occlusion. "Could be DIC," Emilia suggested, watching the purple web expand. "Or a vasculitis triggered by the vascotrill." Shaw's fingers raked through her hair, leaving it standing at odd angles. "We need to figure out what's primary and what's secondary here." The ultrasound technician wheeled in the portable machine. Shaw stepped back, her shoulder brushing against Emilia's. Neither woman moved away. "Start with the abdomen," Shaw instructed. "Let's see if he's bleeding again." The tech spread gel across Jordan's abdomen. The transducer glided over his skin, projecting grayscale images of his internal landscape. "There," Shaw's finger stabbed toward a dark pool near the liver. "Free fluid in the abdomen. He's bleeding internally again." "His platelets are still critically low," Emilia said, scanning the latest labs on the tablet. "And his INR is through the roof. He can't clot." Shaw's jaw clenched. "We need to go back in." "His liver function's too compromised," Emilia countered. "He might not survive another surgery. He definitely won't survive internal bleeding." Their eyes locked across Jordan's bed. The weight of an impossible choice hung between them. Beneath Shaw's clinical mask, something cracked genuine fear leaked through. "His bilirubin's at 8.2, a nurse called out. "Transaminases are 10 times normal limits." "Fulminant hepatic failure," Emilia said, the words barely audible. "We need to call for a transplant evaluation." Shaw's face hardened to stone. "We don't have time for that. He's bleeding out right now. If we operate without addressing the liver failure, we lose him on the table, Emilia insisted. We need to stabilize him first, then consider surgery. With what? Magic? Shaw's voice rose, frustration bleeding through. His platelets won't stay up because he's consuming them as fast as we can transfuse. His liver is shutting down, which means he can't produce clotting factors. It's a perfect storm. Marla stepped forward from her corner. Please, she begged, tears carving paths down her cheeks. Please save my son. The raw desperation in her voice silenced both doctors. Emilia caught the flicker in Shaw's expression, not just professional concern, but something deeper, like a long-buried wound reopening. We'll do everything we can, Emilia assured Marla, then turned back to Shaw. What about tips? Transjugular intrahepatic portosystemic shunt, Shaw considered, nodding slowly. It could reduce the portal hypertension without major surgery. And buy us time to address the liver failure, Emilia added. It's still invasive, Shaw warned, and with his clotting dysfunction, less invasive than open surgery, Emilia countered, and we can transfuse platelets and factors throughout the procedure. Shaw hesitated, her eyes fixed on Jordan's mottled skin. Her clinical mask slipped completely, revealing naked anguish beneath. I've seen this before, she whispered, almost exactly like this. I couldn't. She swallowed hard, the words dying in her throat. Emilia felt a surge of unexpected empathy. Shaw wasn't just fighting for Jordan, she was fighting ghosts. We'll try the tips, Shaw decided, her voice firming. Get IR on the phone and tell them we need a team now, not in an hour. As a nurse moved to make the call, Jordan's monitors wailed again. His oxygen levels plummeted, the digital readout flashing angry red. Respiratory failure. Emilia moved to the head of the bed. We need to intubate. Shaw was already reaching for the intubation kit, her hands swift and sure. She handed Emilia the laryngoscope while preparing the endotracheal tube. Sedation's on board, a nurse confirmed. Emilia positioned herself at Jordan's head, tilting it back to open his airway. She slid the laryngoscope in, his vocal cords appearing in her view. I've got a view. Tube. Shaw placed the endotracheal tube in her hand, their fingers brushing. Emilia guided the tube between Jordan's vocal cords, watching it glide into position. Confirm placement, she instructed. A nurse attached the ambu bag, squeezing rhythmically, while Emilia pressed her stethoscope to Jordan's chest. Equal breath sounds bilaterally. We're in. The ventilator took over Jordan's breathing. His oxygen levels climbed, but his other vitals remained in freefall. His pupils are unequal, Shaw said, light reflecting off the pen light in her hand. Right is larger than left and sluggishly reactive. Intracranial pressure rising. Emilia's stomach tightened. From the earlier hemorrhage? Or a new bleed, Shaw agreed grimly. We need a stat head CT. Interventional radiology is on their way for the TIPS procedure, a nurse reported. They're asking if we want to proceed given his deteriorating condition. Shaw's expression hardened. Tell them to stand by. We need that head CT first. Emilia watched as Shaw leaned over Jordan, examining him with an intensity that transcended professional duty. She searched his body for answers, like someone who'd lost something precious before. We should notify neurosurgery too, Emilia suggested. Already paged, Mercer, Shaw replied without looking up. He's on his way. Marla's sob from the corner cut through the clinical exchange. Emilia moved to her side, guiding her to a chair. We're doing everything possible, she assured the distraught mother. The best specialists in the hospital are coming. This is my fault, Marla whispered, her voice cracking. I should have brought him in sooner when he first complained about the headaches getting worse. Emilia squeezed her hand. This isn't your fault. Jordan has a complex medical condition, several of them, in fact. You've been a good advocate for him. Dr. Carter, Shaw called, her voice taut with urgency. Look at this. Emilia returned to Jordan's bedside. Shaw had pulled back the blanket, exposing his legs. Her knuckles ran firmly along the bottom of his foot. Jordan's toes splayed outward in response, an abnormal Babinski sign indicating upper motor neuron damage. Test the other side, Shaw instructed. Emilia repeated the maneuver on Jordan's other foot, getting the same pathological response. Bilateral Babinski, definitely central nervous system involvement. Shaw pressed her knuckles against Jordan's sternum, hard enough to make Emilia wince. Jordan didn't flinch. No reaction to painful stimuli, Shaw noted, frustration edging her voice. Check his arms. Emilia lifted Jordan's right arm and released it. It dropped lifelessly back to the bed. The left arm fell just as heavily. Flaccid paralysis, she confirmed. This is new. This doesn't fit with anything we've diagnosed so far, Shaw said, raw emotion breaking through. Not the OTC deficiency, not the vascular toxicity, not even the trauma. Could be brainstem involvement, Emilia suggested, if there's swelling or a new bleed. Or it could be something else entirely. Shaw cut her off. She turned to the nurse. Where's that transport team for the CT? We needed it 5 minutes ago. They're on their way up now, the nurse assured her. Shaw paced to the window and back, her composure visibly fracturing. This case, she said, her voice tight. It's like watching him die in slow motion. Without thinking, Emilia laid a hand on Shaw's shoulder, not comfort, but solidarity. She expected Shaw to flinch away. She didn't. Instead, Shaw remained still beneath her touch, accepting the connection. For a moment, they were just two doctors facing the same impossible odds, the same frustrating limitations of their knowledge. The transport team arrived, shattering the moment. We're here for Jordan Hall, CT scan. Shaw stepped back, her professional mask sliding back into place. Let's move. I want images in 20 minutes or less. As they prepared to transfer Jordan, Emilia spotted something else. Wait, she said, pointing to his right leg. Look at this. The modeled pattern had changed, forming a distinct line of demarcation mid-thigh. Above, his skin remained pale with patchy discoloration. Below, it had turned waxy white. Vascular compromise, Shaw said, immediately pressing her thumb against Jordan's toenail. The nail remained white. No perfusion. She checked the other leg, finding the same pattern. Both legs, she confirmed, her voice tight. Bilateral arterial occlusion. That explains the paralysis, Emilia said. Spinal cord ischemia from vascular compromise. Shaw's expression darkened. This changes everything. We need vascular surgery, not neurosurgery. Could still be both, Emilia countered. The pupillary changes suggest intracranial involvement, too. Shaw nodded grimly. You're right. We need both, and we need them now. She turned to the transport team. Change of plans. Take him to CT, but call vascular surgery and tell them to meet us there. We're looking at bilateral arterial occlusion of the lower extremities and possible spinal cord ischemia. As they began transferring Jordan, his monitors shrieked again. His heart rate plummeted. Bradycardia, Emilia called out, heart rate dropping below 40. Cushing's reflex, Shaw said, his brain's herniating. Push one of atropine, Emilia ordered, moving to help with the transfer. The medication went in, but Jordan's heart continued to slow. His blood pressure, paradoxically, began to climb, another classic sign of increasing pressure in his skull. "We're losing him," Shaw said. Controlled panic tightened her voice. "We need to reduce that intracranial pressure now." "Mannitol?" Emilia suggested. "Too slow. We need to hyperventilate him and get neurosurgery to place an ICP monitor." Shaw turned to the nurse. "Call Mercer again. Tell him it's an emergency. We need him now." As they worked to stabilize Jordan, Emilia noticed his legs again. The demarcation line had risen to his hips. The paralysis was climbing, spreading upward through his body. "Shaw," she said quietly, nodding toward the change. Shaw followed her gaze, her expression hardening. "It's moving fast. Whatever this is, it's aggressive." "Could it reach his heart?" Emilia asked, already knowing the answer. "If we don't stop it, yes." Shaw's voice flattened the tone of a surgeon preparing for the worst while fighting for the best. The transport team secured Jordan to the gurney. His mother hovered nearby, clutching his hand. "We'll be right with him," Emilia assured her, "every step of the way." As they wheeled Jordan toward the door, his body suddenly went rigid, his back arching severely, head thrown back, limbs extended. "Decerebrate posturing," Shaw identified immediately. "Brain stem compression." The team rushed Jordan from the room with controlled urgency. Emilia followed, Shaw beside her, both women entirely focused on the unfolding crisis. In the hallway, their eyes met briefly. No words passed between them, only understanding. Whatever tensions existed between them didn't matter now. Only Jordan mattered. Only the medicine mattered. And both women knew, without saying it aloud, that they faced something neither fully understood, something that had already claimed at least one life before. As they rushed toward CT, Jordan's body suddenly went limp. His monitors showed his heart still beating, his ventilator still pushing oxygen, but when Emilia checked his reflexes, she found nothing. No response to pain, no corneal reflex, no gag reflex. Complete paralysis had overtaken him, ascending through his body with frightening speed, claiming territory with each passing minute. This was something else entirely.